Pediatrics presents.
All right. I know, right?
Okay. Hello, I'm Dr. Jeffrey Kyle.
And I'm Dr. Alvaro Raimunde.
Let's talk about pathology in the mouth and what's normal in the mouth in children less than a year of age. So we have a bunch of little topics I think we're going to go through today just quickly because a lot of times parents come in and, there are things that are normal that can look really scary in the mouth, right? So let's just get started. And in children they can be born with teeth or they can erupt teeth in the first 30 days, right?
Yeah.
So what's up with that?
Yeah, babies are not supposed to have teeth.
Do you ever see those pictures of like the little kids with the little
Yes.
dentures? And
Yeah,
it's like,
yeah.
oh, that's weird.
It does not look normal.
Right? But it is. Some kids are born with teeth. Some kids erupt teeth within the first 30 days of birth. We have natal teeth, neonatal teeth. These teeth are part of the primary dentition. So they're not going to lose them and get another set of teeth that's a baby tooth and then get another set of teeth that's an adult tooth. What they'll do is they'll just erupt, and that's it. They'll fall out once they, become age between 5 and 7, typically. But these teeth are, typically erupt without a root. So they sometimes are a little mobile. But it is something that we kind of just monitor.
Yeah, they're just going to ask you something when they're mobile.
Yeah.
Do you ever pull them or no?
So unless there's an issue with, breastfeeding, and any type of traumatic, it's something that's called rigofide, and what that is a trauma to the underbelly of the tongue. And at that point, you could consider. But typically we would just leave them and they'll start to form their roots. They'll harden up, and then
Because I think a lot of the concerns from parents would be, oh, it seems a little loose. Is this a choking hazard?
Right.
Yeah, I think that is more of an old school form of thought. When I was learning in my residency, there were kind of two different thoughts. And the older guys would take them out, and the younger guys would be like, no, wait and watch and wait. So I think there's definitely more of a watch and wait, and that the swallowing of the tooth is not something that it really happens, or we have anything really supportive that would give us a reason to remove those teeth.
One of the things that get confused with a neonatal tooth or a natal tooth, I get a lot of parents who's like, oh, I think my kid is teething. Look, there's a white little bump on the gums. Or conversely, what are these bumps on the roof of my kid's mouth? And we get that question pretty often. So is this normal? Should parents be concerned? What are these little white bumps?
What are the bumps? The bumps are typically normal. They're what can be called Epstein pearls. They're Bond's nodules. Ultimately what they are is little accumulations of keratin. And they're on the, alveolar ridge. It's not necessarily a tooth coming in quite yet. But
And we get tons of questions like, oh, I think my child's getting a tooth and they're 2 months old and they have a little white pearl on their gum line. And,
right, yeah. And it's great that these parents are looking in the mouth. I think that's awesome. I really, really love that. And they're seeing these changes and they're seeing these different things. But no, it is something that's normal. It might not be a tooth quite yet, but it is just a normal little.
So we don't pop them?
Don't pop them. No, please.
Yeah.
They will resolve.
Yeah, there's it varies where they're located. They're often on the hard parts. So like, as we said, the alveolar ridges, which are kind of the bony parts, the palate, they can be different sizes, different locations, but they're generally on that hard structure, and they do just self-resolve. So yeah, don't go poking around and popping them like this.
Yeah.
Restrain yourself.
Another question that we get often in the office regarding the baby's mouths is sometimes the babies on their gums or in their mouth, they'll have what looks like like a swollen, purpley kind of mass, almost like a bruise. And they come concerned, and like I said, they could be on the gums or even under the tongue. Like, what are these? Are they the same thing?
Uh, so I think at that point, having like an image and knowing the location of it is, one a good start. There is something called the congenital epilys that you typically will see at birth. So, it has this suddenly started, were they born with it? How big is it? The location. So you kind of have to start with what we call like a differential. So there's like a number of things that could be, and it's something that when described over the phone you may not really know, and then you have to kind of start looking in the mouth and you have to go through that differential. But my guess might be a congenital epilys.
Yeah, the congenital epilys. Yeah, they're typically found on the anterior portion of the maxilla, so in the front.
And that can be a problem when you have that, depending on how big they are. Sometimes they can obstruct the airway. They can be a big
Oh, they
bleeding
can be that big.
issue. Yeah. So not something we see so often, and when we do see them, we typically then refer them even further to another specialist, an oral surgeon, who can evaluate whether or not they would have to be removed.
Mm-hmm. And white tongue is very common
Mm-hmm.
in babies because a lot of their nutritive comes from milk, which is whitish in color, and oftentimes parents get concerned about thrush, and rightly so, because that is common in very young infants because their immune system is not ready to fight off the fungus, Candida, that causes thrush. So, any tips on how a parent could tell the difference?
Try to wipe it.
Yeah. Right.
That would be the
Mhm.
biggest concern, like recommendation I have. If it wipes off, it's most likely milk tongue.
Yeah.
If it doesn't wipe off, then we have
Mhm.
a bigger hill to
Sure.
tackle.
And oftentimes milk tongue is on the tongue, and you don't see it as much in the other parts of the buccal mucosa or the inside of the cheeks.
Yeah.
Sometimes it could collect there, but it looks more watery and it easily, like you said, wipes out. But even milk tongue, in and of itself, to differentiate from thrush, I would say, is it look like it's build up, like really plaquey on the tongue. Because oftentimes thrush looks a little bit more scary, I think, when you look at it.
Yeah.
It's like, oh, what's that in the mouth? Because it builds up. And oftentimes, if you don't know, if you let it go for a couple of days, it'll start spreading to other parts of the mouth, and the diagnosis is pretty easily made at that point.
Yeah. You can also make a connection with it. Do you talk to them, the moms sometimes? Do you talk to them about treating themselves also if they're
If they're
breastfeeding?
yeah.
So you can maybe kind
100%.
of make that connection as well.
Definitely. Yeah, and the thrush lesions you'll see in the pictures. Once it really gets going, you'll see it on the roof of the mouth, on the sides of the cheek, and the back of the throat. Whereas the milk tongue is pretty much just on the tongue. So that's
Yeah, and for the breastfeeding moms, your point well taken. A good history of as you're breastfeeding, all of a sudden becoming painful. Sometimes moms will say that, "Gosh, it feels like my nipple when my baby sucks it's like shards of glass being put into my nipple. Actually, it's very painful and burny. So that's a good way to know that my baby is thrushed.
Yeah, and when we are seeing milk tongue, which we might see a little bit more often when we're getting referrals to have an evaluation done for frenums, or also known as tongue ties, lip ties. So one of the signs that a child can be pretty bound down is that development of the milk tongue, and that's because when that tongue is bound down at the bottom, at the base of their mouth, when they close and swallow, that tongue does not lift and compress against the palate. And the palate, all those little ridges up there, serve as a way to kind of cleanse off the tongue. So that could also be a sign of something that's normal in the mouth, which is frenum. And you have one up under your tongue, which we refer to, under your lip, that we refer to as labial frenum. You also have some towards the back called buccal frenums, and you have some under the tongue called lingual frenums. So these are all normal things. That's a thing that we get often. Is this normal? Is this tongue tie normal? All ties are normal. All frenums are normal. It's just a matter of functionality, and that really depends on every baby and every mom.
Yeah, that's a really good point. And it would make a great other video if anybody
for
wants
sure.
to hear us talk about tongue ties and, should we clip them? Should we laser them? Definitely write down in the comments below, and maybe we'll do a video on tongue ties and
Definitely
What-
a hot topic.
what's the
these days,
controversy for
Mhm.
sure. But yeah, and if you want to hear more about thrush, we also have another video on thrush out on our website, on our YouTube page as well. Great. Yeah, so I think those are, I think, the most common pathologies of the mouth in kiddos younger than about a year old. And stay tuned. We'll shoot another one on common conditions in kids over a year old.
And if you enjoyed this, like and subscribe to our YouTube channel.
Thank you very much.
Thank you.
Thank you.
Bye bye.